Hi guys, welcome back to my YouTube channel, and if this is your first time, you are welcome. My name is Jess and I'm excited that you're here today. In today's video, I'll be talking about the Dutch healthcare system. I've had a couple of interesting experiences since I moved here, and I just thought, you know what, it'll be great to do a video about the Dutch healthcare system because it may be helpful to someone out there. It may be helpful if you're coming in soon as an expat, or maybe you're here and you haven't really experienced it as much. So stay with me. So I'm going to be starting with a few must-knows about the Dutch healthcare system, and then towards the end of the video I will be sharing my interesting experience, maybe one or two. So if you're looking to hear that, just then don't skip this video. So let's start with a few facts. The first thing is healthcare is not free in the Netherlands. To access healthcare in the Netherlands, you need to purchase a health insurance in the Netherlands. And this is a monthly payment that comes from your account by yourself, or at least there'll be an auto debit to your account. Health insurance in the Netherlands is mandatory. It is compulsory for every single individual or family living in the Netherlands. So whether you're a citizen or a permanent resident or an expat like myself, you will need to pay a premium on health insurance every month to access healthcare. And the mandatory health insurance is the basic health insurance. However, it may not be applicable to you if you're only here for a very short amount of time. Maybe you are a temporary resident, or you're here on what feels like a long business trip, but it's a short amount of time because you're going to go back to your home country. Then you don't need to take out a health insurance in the Netherlands. So you either take out a health insurance because you are a citizen or a permanent resident or an expat who is going to live here for a long period of time, or your situation is that you are an EU citizen with an EU health insurance card. And then lastly, maybe you fall into the category of folks who are here on a temporary basis, maybe for work or for school or something, but you are only going to be here for a short period of time and you have a private healthcare insurance from your country of origin. This last category of people are usually like international students, or maybe your employer sent you here for a course or for a period of time and your employer is covering it from the health insurance that they provide as an organization. So for folks with kids or dependents like myself under the age of 18, I don't mean that I'm under the age of 18, I mean I have a kid under the age of 18. In any case, healthcare is free for the children or the kids or the dependents under 18 under the coverage of their parents or their guardians. Let's talk about if you're coming in as an expat. If you come into the Netherlands as an expat, you have a 4-month window to purchase a health insurance plan. Remember, it's the basic health insurance that is mandatory or compulsory for every single individual living here to purchase. You may wonder, what will happen if I don't get the health insurance within 4 months? A lot can happen if you don't get the health insurance within 4 months. If you don't get the health insurance within 4 months and the government finds out, because they will find out, they have everything in their systems, they will send you a letter to remind you to purchase a health insurance plan. It's the basic one. That's what they're asking you to do. Now, if they give you an amount of time, maybe another month or 2 or 3, you still haven't done it, then you're going to be fined. I mean, if a country says that something is compulsory or mandatory, then obviously it becomes a crime if you don't do it. So let's go back a little bit to the basic insurance. The basic insurance plan covers the basics. So think about basic and essential medical care, from going to see your GP to getting a few prescriptions here and there, short-term hospital stays and minor procedures, etc. This basic insurance has an average cost of 100 to 140 depending on the health insurance provider that you use. These health insurance providers in the Netherlands are privatized, but through the insurance that they sell, you get access to general medical care. I personally use one that is quite expat friendly, and it costs about 135 euros per month. So the basic plan does not cover specialist care such as dental care, physiotherapy, orthodontics, and cosmetic procedures. So if you want to access such care, such medical care, you're going to need to buy or pay premium for a supplementary health insurance. You have different supplementary health plans or health insurance plans, And you can have the dental one, you can have one for physiotherapy and orthodontics. You can have another one for long-term chronic diseases and whatnot. If you want a supplementary plan, say you want to purchase the one for a dental plan or just dental health care, that cost could vary from about 10 to 12 euros a month to maybe 40 euros a month, depending on the healthcare provider or insurance company that you use. So if you think about paying an average of say 120, 130, depending on the insurance company that you use as your basic, which is the compulsory one, and you want to add like maybe 1 or 2 supplementary healthcare plans, that could ultimately come to 140, 130, 150, maybe something under 200 euros a month for each individual. Depending on your health insurance or the type of plan that you're on, you could have coverage for up to 75% of your cost. So basically you want to know how much in cost the plan actually covers in terms of insurance coverage. If you get reimbursed, when you get reimbursed, like in what circumstances or situations would you get reimbursed and up to how much? So now you have your health insurance, and then you or someone in your family or in your household requires medical attention. Let's talk about what you need to know when you find yourself in that situation. Number one is that you cannot go to a hospital directly. You need to see a GP first, and the GPs are called Huisarts here. You need to see a Huisarts first, and they will determine whether your condition is serious enough to actually warrant a visit to the hospital. So it's basically up to them to decide whether or not you indeed need that level of medical attention. Now, these Huisarts operate and work in offices. So you're actually going to see them in an office. It's not a medical facility. They don't have, serious medical tools there, right? It's just an office. It's not even a clinic. So before you can even see a Huisarts, you need to book an appointment. And I want to say that booking appointments is not always so straightforward. If you feel like your case is an emergency, it may not be an emergency to them. So maybe you feel a certain way on Friday, they could tell you to come on Monday. In other words, the appointment is usually based on their availability and not yours. So, yeah. But in any case, you need to make sure that you check the websites, book the appointment through the route that they've suggested, and then go see the Huisarts or the GP when it is your appointment day. Another interesting thing to note about these appointments is that they last about 10 minutes tops if you're lucky. I usually get 10 minutes, but I've heard some people get 5 minutes. And no long story, tell them exactly how you're feeling and you're out the door. There's an advantage to this. It means that you're not going to be in line waiting for your turn. You go when you're supposed to be there. They're expecting you. They know you're coming, they're waiting for you. So to my Nigerian family and friends, there's no such thing as, let's rush to the hospital immediately. Does not exist, because even what you consider to be an emergency is most likely not an emergency to them. So to be honest, falling sick here is a little bit scary for me because, they just may not take you as seriously as you take yourself. And on one hand, you're probably wondering, maybe it's not that serious. Even if I feel it's serious, if the doctor says it's fine, then I guess it's fine. But you know when you're not feeling right. The doctor is not feeling you. They're not you. They're not feeling what you're feeling. So they may not get it. But they are experts. So you need to trust. You need to really, really trust here. Another thing to note is these Huisarts or GPs are only available in their offices Mondays to Fridays. So if you need medical care during the weekends, there's a separate general number to call, not your GP. If it's an emergency as well, there is a number to call for emergencies. Let me just take advantage and tell you my story. Now, I think the worst one that I've experienced so far is sometime last year, my son had diarrhea, and I'm someone who's suffered from food poisoning a lot, so I know how bad diarrhea is, like the stooling, the vomiting, the loss of weight, the loss of appetite, dehydration, to name a few. And then my son at the time was about 14 months and going through this. I think he had caught something from daycare. Day 1, day 2, the situation did not get any better. We then decided to call the GP on the 3rd day, and they asked, all these questions, and they said it wasn't serious. So basically, they do not consider diarrhea to be a big deal, whether it's in an infant, a baby, a child, an adult. They feel like you need to wait until it gets to the 10th day before medical care can be rendered. Or if your child is extremely dehydrated, like no wet diapers, or has lost a serious amount of weight. Of course, as a mom, as you can imagine, I was livid. Of course, I don't even want to. And then I said, okay, I'm hoping that, it subsides on that third day or the fourth day, fifth day, sixth day, seventh day. I was calling all this while, by the way, and they were telling me the same thing. So on the seventh day, I'm like, listen, this is a little boy here. And then they were saying the same thing. I just said, you know what? I'm not having it. I decided that day that I wasn't taking no for an answer before I called them. So I said, whatever I needed to do, I will make sure that my son saw someone saw my son, checked my son, and then I would feel better afterwards. I eventually had to shed a few tears here and there before they told me to come in. When the GP checked my son, she literally called the hospital to book a room for us. So it was that serious. They were also thinking, could this be COVID? What could this be? So it was a big deal for them all of a sudden. What if I didn't make some noise on the phone? Another thing is they don't give medications here randomly. So if someone has diarrhea, like I'm telling you, my son did, there is nothing really prescribed. So yeah, that's one of my crazy experiences. Not fun. So I think that's a good way to close this video. The final tip is if you're uncomfortable about an invoice, if you read the invoice, understand the invoice, it just doesn't make sense to you, please make some noise. And on the flip side, one thing I really love about the healthcare system here is you can get medical advice from your GP over the phone. So you don't necessarily have to make an actual physical visit or go to a hospital. And if you are in the Netherlands and you've got some tips and tricks for me, please, dears, put them in the comments below. I know that you can change your GPs if they're not working for you, but I try to be as patient as possible, right? And if you've also had some interesting experiences, I'd love to hear about them. So feel free to share your stories in the comments, okay? Lastly, if there's any content or topic you'd like me to talk about, please leave them in the comments as well. Thank you for watching. And if you enjoyed this video, give it a thumbs up. And if you watched this video to this point, I think it's only right that you subscribe to my channel. Don't you think? Thank you. And I'll see you in my next video.